আমরা স্টার্ট করি। আমাদের আজকের টপিক হচ্ছে হার্ট। সো আমরা হার্ট নিয়ে কথা বলবো, মাঝখানে একটু পেরিকার্ডিয়াম নিয়ে বলতে পারি, তবে আমি পেরিকার্ডিয়াম পুরার একটা আলাদা ক্লাস নিব যদি সম্ভব হয়। তো তোমাদেরকে আজকে আমি হার্ট নিয়ে বলবো। হোয়াট ইজ হার্ট অ্যাকচুয়ালি? হোয়াট ইজ হার্ট? If I want to know from you, if I want to tell you that what is heart, heart is a hollow, somewhat conical, muscular, central pumping organ. Okay, I have uttered several names. Hollow. Why this is hollow? Because there are several cavities. We all know that heart has got 4 cavities, right? 4 chambers. So that's why we call it. We can name it a hollow organ. And it's muscular organ. Why? See, in this picture, you can see the wall of the heart. In this picture, you can see the wall of the heart. This is the wall of the heart, and wall of the heart actually has got 3 layers. Okay, we have cut a portion of the heart from here. If you follow my cursor, a portion of the heart is cut from here, and this is magnified here. So there are 3 layers in the wall of the heart. Epicardium is the outermost layer, myocardium in the middle layer, and endocardium is the innermost layer. Okay, so endocardium is the innermost layer. So see, this is the thickest layer, right? Myocardium is the thickest layer, and myocardium is composed of cardiac muscles. Myocardium is composed of cardiac muscles, and we will go through the cardiac muscle, the characteristic features of cardiac muscle later on. Now I'm telling you that why we can call it a muscular organ, because the muscular coat or myocardium coat in the wall of the heart, histological structure, that is the muscular coat is the thickest layer. Okay, so basically it's muscular structure, but there are 3 layers from outside inwards: epicardium, myocardium, and endocardium. If I tell you about the covering of the heart, that is the pericardium. You all know about that. This is the serous covering of the heart, and this covering, pericardium, has got several layers, and basically it has got 2 layers, and basically it has got 2 layers, and the visceral layer of the serous pericardium is known as epicardium actually. Okay, so pericardium can be divided into serous pericardium, fibrous pericardium, and serous pericardium. Okay, and the visceral layer of the serous pericardium is known as the epicardium. So this epicardium, outermost layer of the heart, is made up of basically pericardium, and the middle layer in the wall of the heart, that is the myocardium, and myocardium is made up of cardiac muscles, and the endocardium is made up of endothelial cells. Okay, just like other blood vessels, inner lining of the other blood vessels, this is the endothelium. Okay, endothelial cells, they line the endocardium. So this is the innermost layer. And what are the characteristic features of cardiac muscle? If I want to tell you a bit, that is cardiac muscles are cylindrical, short, and branched. Okay, branched muscles, and they are composed of a single centrally placed nucleus. And the most important structure, characteristic feature of cardiac muscle is present here, the deep blue colored. This is the intercalated disc, and due to presence of intercalated disc, the whole of the heart act as what? Syncytium. Okay, that means act as a unit. Whole of the heart act as a unit due to presence of intercalated disc. Okay, and this is the special characteristic feature of cardiac muscle fiber. Okay, so these are some added information. I was in the definition of heart, right? So heart is a hollow organ. Heart is muscular organ, somewhat conical in shape. You can see that. You will see in the viscera, and this is not possible for me to show you the viscera now, but please, obviously, you go through the viscera in your respective medical colleges. Okay, so somewhat conical organ, and I have uttered another word, central circulatory or pumping organ, right? Heart is the central circulatory or pumping organ. If we want to know about the circulation of the whole of the body, there are basically three types of circulation. Okay, pulmonary circulation, systemic circulation, and portal circulation. We are not concerned about portal circulation now. If I want to show you the circulation, okay, no, if this is not here. Okay, so I want to tell you about the circulation. Pulmonary circulation is the lesser circulation, and systemic circulation is the greater circulation of our body. Okay, heart has got 4 chambers, I have told you, and these are the 2 atria and 2 ventricles. Okay, see, this is the right atrium, this is the left atrium, this is the right ventricle, and this is the left ventricle. Okay, right atrium drains blood from superior and inferior vena cava, and superior vena cava drains blood from upper part of the body, inferior vena cava drains blood from the lower part of the body, and ultimately all the deoxygenated blood from upper and lower parts of the body are drained into the right atrium through superior and inferior vena cava. And from the right atrium, the deoxygenated blood enters into the right ventricle through the right atrioventricular orifice, or here there is a valve named tricuspid valve. And from the right ventricle, the deoxygenated blood enters into the pulmonary trunk. This is the pulmonary trunk. Okay, the outflow tract of the right ventricle is the pulmonary trunk, and through the pulmonary trunk, we all know that pulmonary, this indicates the lungs. So through the pulmonary trunk, the deoxygenated blood actually enters into both lungs, into the right lung by the right pulmonary artery, and into the left lung by the left pulmonary artery. Okay, so pulmonary trunk is the only artery of our body that carries deoxygenated blood. Okay, pulmonary artery is the only artery of our body that carries deoxygenated blood, and this is the pulmonary trunk is the outflow tract of the right ventricle. Okay, and so the deoxygenated blood through the pulmonary trunk and right and left pulmonary arteries enters into the lungs, and their oxygenation occurs. And after being oxygenated, the oxygenated blood enters into the left atrium by 4 pulmonary veins. See, there are red colored 4 pulmonary veins, 2 right pulmonary veins and 2 left pulmonary veins. And these pulmonary veins are the only veins that carry oxygenated blood. That's why they are indicated by red color. Okay, so via 4 pulmonary veins, the oxygenated blood enters into the left atrium, and from the left atrium, the oxygenated blood enters into the left ventricle through the bicuspid valve. Okay, or left right atrioventricular orifice. Left atrioventricular orifice, here bicuspid valve is present. Bicuspid, that means it contains 2 cusps. We will see later on when we will go through the interior of the heart. Okay, so left atrium and left ventricle, they are communicated by bicuspid valve, and the oxygenated blood will be present here in the left ventricle, and from the left ventricle, the oxygenated blood will be supplied to the whole of the body by aorta. Okay, so the outflow tract of left ventricle is ascending aorta, and the ascending aorta is continuated with the arch of the aorta that is seen in the picture. This is the arch of the aorta, and ultimately in the posterior part of the heart, there is descending aorta. Okay, so aorta, the lower part of the aorta, the descending aorta, some of the part is present in the thorax, that is known as descending thoracic aorta, and through the aortic opening of the diaphragm, it enters into the abdomen, and that part of aorta is known as abdominal aorta. Okay, So descending thoracic aorta, abdominal aorta, they supply the lower part of the body. And what about the other upper parts? Upper part of the body will be supplied by these three branches of the arch of the aorta. These three branches, if I want to name them from right to left, the brachiocephalic trunk, left common carotid artery, and left subclavian artery. These are the three main branches of arch of aorta, and they are responsible for oxygenation or blood supply of the upper part of the body. Okay, so I was in the circulation, pulmonary and systemic circulation. See, from the left, right atrium to the right ventricle, and then pulmonary trunk, and then lungs, and ultimately up to the lungs. This is the pulmonary circulation. Okay, pulmonary circulation starts from the right atrium and ends in the lung. Okay, this circulation, this small circulation is known as pulmonary circulation. Okay, and what about the systemic circulation? Systemic circulation starts from the left atrium, and from the left atrium, oxygenated blood enters into the left ventricle and then to the whole of the body. This circulation is known as the systemic circulation. This is the greater circulation. Okay, is that clear to you? I think it's clear to you. So why I'm telling about the circulation? Because I want to describe the word central circulatory organ or central pumping organ. Okay, so I was in the definition of heart actually, why this is called hollow organ, why this is called muscular organ, and why this is called the central circulatory organ. It is situated where? Heart is conical in shape, and where it is situated? It's situated in the middle mediastinum. If I want to know what is mediastinum, that's another topic. Just know that heart and the great vessels, roots of the great vessels attached to the heart, they are the contents of middle mediastinum. Okay, and the arch of the aorta and branches of the arch of the aorta, they are the content of superior mediastinum. Okay, and behind the heart there is posterior mediastinum, and the descending thoracic aorta and other structures, esophagus and trachea, they are the contents of posterior mediastinum. So as a whole, if you are asked that where the heart is located at the middle mediastinum. This will be the answer. Okay. So now let us talk a bit about the measurements. At first, I want to show you the gross anatomical features. See here. Heart has got an apex. This conical most lower portion is known as the apex. Okay, and the base, if I want to show you the base, this is the base actually at the posterior surface. This is the base. Okay, an apex, a base, and it has got three surfaces. Okay, this surface is known as the sternocostal surface. This surface which we are seeing, this is the sternocostal surface. And if I want to show you the this is the diaphragmatic surface or inferior surface. Okay, and here there is left surface. Actually, this will be cleared when you will hold the viscera. Okay, so now I can only tell you that heart has got three surfaces: sternocostal surface, diaphragmatic surface or inferior surface, and diaphragmatic surface or inferior surface, and the left surface. And it has got three borders. Right border, this is the right border. If you follow my cursor, this is the right border from the opening of superior vena cava to the opening of inferior vena cava. This border is known as the right border. From the opening of the inferior vena cava to the up to the apex of the heart, this border is known as the inferior border. Okay, this border is known as the inferior border. And this structure, muscular two structures, like what should I say? Like the ear of the elephant. Okay, so these muscular structures are known as auricle. There are two auricles. we shouldn't utter their name in the gross anatomical feature, but I'm telling you because I need this auricle, this left auricle, to describe the left border. Okay, so these are two muscular structures. Actually, these auricles are have got some clinical importance. Okay, in the auricles, as their muscular structure, in between their muscles, this is a site for formation of thrombus. What is thrombus? We can call them blood clots. Okay, so these thrombus, if they are dislodged in the blood, in the circulation, they are known as emboli, and they are very bad for our circulation, and they produce a very bad clinical condition. So what is the clinical importance of auricle? They are the site for formation of thrombus and ultimately leading to embolism. Okay, so auricle, this left auricle, from the left auricle up to the apex, this is the extension of the left border of heart. Okay, this is the extension of the left border of heart. So in the gross anatomical feature, what I have told you, there are three borders, three surfaces, an apex and a base. Okay, apex is conical. And if I want to describe about apex of the heart, I should tell you the measurement first. Okay, so if I want to tell you about the measurement, apex to base, this measurement is about 12 centimeter, and the anterior-posterior diameter, already you all know about the anterior-posterior. What does it mean? Anterior means in front and posterior means behind. So the total anterior-posterior diameter is about 6 centimeter, and widest transverse diameter, whenever we we do a chest X-ray posterior anterior view, PA view we call it, in the chest X-ray posterior anterior view, the ideal diameter, widest transverse diameter of heart, transverse diameter, that means horizontal from here to here. Okay, the widest transverse diameter should be 8 to 9 centimeter. Okay, and the transverse diameter should not be more than 50% of the diameter of the thorax. Okay, total diameter of the thorax will be double of the widest transverse diameter of the heart. That's the ideal condition. If the widest transverse diameter exceeds the total transverse diameter of the thorax, that condition is known as cardiomegaly. Okay, so this is all about the measurement. And now let us go to the gross anatomical features, description of the gross anatomical features. I have told you the names of the gross anatomical features. And the apex, this is a very important question of Viva. What's that? What is the location of apex? Location of apex or apex bit. Okay, we can feel the apex bit from the surface of our body. Okay, so where should we locate it? It's located at the left fifth intercostal space, just medial to the mid-clavicular line. Mid-clavicular line, we all know that at the central position of the clavicle. If we think an imaginary line, that is known as the mid-clavicular line, and just medial, that means just medial to the mid-clavicular line. Mid-clavicular line, just medial to the mid-clavicular line at the left fifth intercostal space, the apex is located. Okay, and we will locate there the apex bit on the surface of our body. In some conditions, in some human beings, the apex bit may be located at the right fifth intercostal space. That condition is known as dextrocardia. Okay, so in that human being, not only the heart, but other organs that are situated in the left side, they are situated in the right side. In usual cases, other organs like stomach, like spleen, they are situated in the left side. Okay, but in people where dextrocardia is present, Other organs like stomach and spleens are also will be found in the right side, and this condition is known as situs inversus. Okay, this condition is known as situs inversus. I'm telling the clinical conditions along with the topics. Okay, all these clinical conditions can come in the written exam as short questions bearing 2 or 2.5 marks. Okay, so all of these are important. So situs inversus, this is a condition where change of side of all viscera, side, S-I-D-E, okay, side of all viscera, change of side of all viscera occurs, including heart, spleen, and stomach. They are present on the right side. This is accompanied by dextrocardia. Dextrocardia means if the apex of the heart is located on the right fifth intercostal space instead of on the left fifth intercostal space. Okay. And apex of the heart, if I want to tell you about the formation of the apex of the heart is formed only by the what? Apex of the heart is formed only by the ventricle. Which ventricle it should, which ventricle? Can you please tell? This is a pause. This is a pause for you to think actually. So I have told you about two ventricles, right? I have told you about two ventricles, left ventricle and right ventricle. Here, this is the left ventricle. Okay, this is the left ventricle we can see, and right ventricle is seen there. So apex of the heart is here. So apex of the heart is formed by left ventricle. This will be the answer. Okay, we have to know formation of each of the parts of the heart. Now come to the base of the heart. Base of the heart, this is the most fixed part of the heart. We all know that heart is pumping continuously and the parts of the heart is not fixed, but base of the heart is the most fixed part of the heart. Okay, so this is the base of the heart. How it is formed, formation, if I want to tell it at first. Base of the heart is formed by two atria only. There's no contribution of the ventricles, okay? So base of the heart is formed only by two atria, but 2/3 and 1/3. There are some 2/3, 1/3 features in heart. 2/3 of the base of the heart is formed by left atria and 1/3 of the base of the heart is formed by right atria, okay? And base of the heart is a vertebral level, we should know. In the standing position, it's opposite the 6 to 9 thoracic vertebra, okay? 6 to 9 thoracic vertebra in case of standing position, and in case of recumbent supine position, that whenever we lie on our back, in that position, the base of the heart is situated from 5th to 8th thoracic vertebra, and the relation of the base of the heart is very, very important for your written exam, for your MCQ, and also it comes in the OSCE exam, okay? So relation of the base of the heart, there are several structures that are related to the base of the heart. If I want to show you, just a minute. Okay, so for the mediastinum part, these are the structures. So there's a trick. There's a trick. The contents of posterior mediastinum are related to the base of the heart. Okay, so contents of posterior mediastinum, this is also important for you, and you have to memorize it separately. So this is a trick that all the contents of posterior mediastinum are related to the base of the heart. So what are the structures related to the base of the heart? At first, you should say that oblique pericardial sinus. Okay, Oblique pericardial sinus is related to the base of the heart, fibrous part of the pericardium, posterior part of the fibrous pericardium, and only the right pairs of pulmonary veins are related to the base of the heart. And now come to this picture, right and left principal bronchi. This is the trachea, this sky blue colored structure behind the arch of the aorta. This is the trachea, and this is the right principal bronchi, and this is the left principal bronchus. Right and left principal bronchi, they are related to the base of the heart. And esophagus with plexus of nerves. Esophagus, this is the muscular food pipe. This is the muscular food pipe of our body that enters into the abdomen through the esophageal opening of the diaphragm. So esophagus, along with the plexuses of nerves, this is also related to the base of the heart. And descending thoracic aorta, obviously this is the content of the posterior mediastinum, descending thoracic aorta, this red colored structure. This is also the content of the base of the heart. And thoracic duct, here it's not present in this picture, but it's related. This is the thoracic duct, okay? This beaded appearance, thoracic duct has got beaded appearance, and this is the main lymphatic duct of our body that drains lymph from the left side of our body mostly, okay? So thoracic duct, it is also related to the posterior mediastinum, okay? So thoracic duct and agaricus and hemiagaricus veins, you see this is the arch of agaricus vein. Here the arch of agaricus vein, if we see in this picture, this is the agaricus vein, and this is the sympathetic plexus, okay, and this is the arch of agaricus vein, okay? So arch of agaricus vein, and actually the whole agaricus system of vein, this is related to the base of the heart. Agaricus and hemiagaricus vein, greater and lesser splanchnic nerves, and some lymph nodes, posterior mediastinal lymph nodes. So the relation of the base of the heart, this is very important. At first you should tell oblique pericardial sinus, then you should tell the posterior part of the fibrous pericardium, then right pair of pulmonary veins, and then the contents of the posterior mediastinum. What are the contents of the posterior mediastinum? Right and left principal bronchi, esophagus, descending thoracic aorta, and along with the esophagus, the plexuses of nerves, and descending thoracic aorta, thoracic duct, some of the lymph nodes, agaricus and hemiagaricus vein, and greater and lesser splanchnic nerves. Okay, so these are the contents of posterior mediastinum, and they are also, these structures are also related to the base of the heart. Okay. So this is a very important question you should remember. And vertebral level of the base of the heart in standing and recumbent supine position. So I have told, I want to tell you about the clinical base of the heart. Okay, what do you mean by clinical base of the heart? Right second intercostal space to the left second intercostal space. This is known as the clinical base of the heart. This is actually the pulmonary area. Okay, so now come to the apex and base. We have completed the portion of the apex and base. And this is the right border. I have already told you the extension. It extends from the opening of the superior vena cava to the opening of the inferior vena cava. And the right border is formed only by the right atrium. Okay. And there's a feature of the right border. What's that? That is the sulcus terminalis. Okay. And this sulcus terminalis, it indicates that in its interior, there is the presence of crista terminalis. What is crista terminalis? I will tell you later on. Okay. So just you remember that right border of the heart indicates sulcus terminalis, and it is formed only by the right atrium, and it extends from the opening of superior vena cava to the opening of inferior vena cava. Now come to the inferior border. Extension I have already told you, from the opening of inferior vena cava up to the apex of the heart, and along right border separates the sternocostal surface from the base of the heart. Okay, and the inferior border separates the sternocostal surface from the inferior surface or diaphragmatic surface, and it's made up of, how it is made up? It's made up of, it separates the sternocostal surface from the diaphragmatic surface, and its extension I have already told you. Yes, it has an depression, or it has an what should I say? It has a depression, I should say, that is known as incisura apicis cordis. Okay, incisura apicis cordis. What's that? This is a depression along the inferior border of the heart, through which the anterior interventricular branch of right coronary artery winds round the inferior border. Okay, so anterior interventricular branch, here I should tell you about the anterior interventricular groove. Okay, this is the anterior interventricular groove. Anterior interventricular groove. Anterior interventricular groove separates the right ventricle from the left ventricle. Okay, the sternocostal surface of the right ventricle and the left ventricle is separated by the anterior interventricular groove. And this groove here, a flag is given for the OSPE exam, and you should know the contents of the anterior interventricular groove. What are the contents? This is the anterior interventricular branch of left coronary artery. Okay, anterior interventricular branch of left coronary artery. Okay, and also there is a vein. What's that vein? That vein is known as great cardiac vein. Okay, this is the great cardiac vein. So if I want to know, if teachers want to know from you about the contents of anterior interventricular groove, what are the contents of anterior interventricular groove? Anterior interventricular branch of left coronary artery, great cardiac vein, and there are some other contents, lymphatics, nerves, and fat. You can tell this. Okay, lymphatics, nerves, and fat. This is the content of anterior interventricular groove. Okay, so about the left border extends from the left auricle to the apex of the heart, and it separates the sternocostal surface from the left surface. Okay, so there is a left surface, and in case of inferior border, we can say that the inferior border is accompanied by right marginal vessels. Okay, right marginal vessels, that means right marginal artery and right marginal vein. And the left border is accompanied by left marginal vessels. Okay, so inferior border accompanied by right marginal vessels, and left border accompanied by left marginal vessels. And now come to the sternocostal surface. This is the sternocostal surface. It has got contribution from the atria and the ventricles. Okay, in case of atria, the right atrium and its auricle and part of left auricle is contributed to form the sternocostal surface. And in case of ventricular contribution, 2/3 of the sternocostal surface is formed by right ventricle, and 1/3 of the sternocostal surface is formed by left ventricle. Okay. Okay. If I want to tell you about the diaphragmatic surface or the inferior surface is formed. Inferior surface is formed by what? 2/3 by the left ventricle and 1/3 by the right ventricle. Okay, diaphragmatic surface or inferior surface, and there is a groove there. See, there is a groove here. This is the posterior interventricular groove. Okay, this is the posterior interventricular groove, and this posterior interventricular groove lodges, interventricular groove lodges what? Here I should say. This is the posterior interventricular groove. Okay, this is the posterior interventricular groove, and it lodges the posterior interventricular branch of right coronary artery. Okay, posterior interventricular branch of right coronary artery and the middle cardiac vein, and also the anastomosis of both interventricular arteries. That means anterior interventricular artery and the posterior interventricular artery anastomos here. I have already told you that anterior interventricular artery winds round the inferior border at the incisor apices cordis and reaches the posterior interventricular artery and ends by anastomosing with the posterior interventricular branch of right coronary artery. Okay, so what are the contents of posterior interventricular groove? The posterior interventricular branch of right coronary artery, the middle cardiac vein, and that's three common things: lymphatics, nerves, and fat. Okay, and this interventricular groove actually separates both ventricles. The posterior interventricular groove separates the diaphragmatic surface of left and right ventricles. Okay, and see, the diaphragmatic surface is formed 2/3 by the left ventricle and 1/3 by the right ventricle. Okay, and the atria and ventricles, they are separated by atrioventricular groove. This is the atrioventricular groove. In front, the atrioventricular groove is deficient due to presence of pulmonary trunk. Okay, and behind it's continuous. This is the atrioventricular groove. In the exam, you will be asked to trace the atrioventricular groove using your index finger of right hand. Okay, so you should trace that. What are the parts of atrioventricular groove? Atrioventricular groove has got two parts at first, the anterior portion and the posterior portion. And the anterior portion again can be divided into a right part and a left part. Okay, anterior portion of the atrioventricular groove can be divided into a right part and a left part. The right portion, right part of the anterior interventricular groove, it contains, what is its content? It contains the trunk of right coronary artery and it is crossed by anterior cardiac veins. Okay, so what are the contents of right part of anterior atrioventricular groove? Right coronary artery trunk of right coronary artery, and it is crossed by anterior cardiac veins. Okay, what are the contents of left part? Left part here, the trunk and circumflex branch of the left coronary artery. Okay, the end or the termination of the great cardiac vein and the commencement of coronary sinus. These are the contents of left part of the anterior atrioventricular groove. Okay, so three contents. What are they? Trunk and circumflex branch of the left coronary artery, the termination of the great cardiac vein. See, this is the great cardiac vein. Actually, great cardiac vein is the content of anterior interventricular groove, but its termination is the content of left part of anterior atrioventricular groove. Okay, and the commencement of coronary sinus. Okay, what is coronary sinus? I will tell you later on. Now, just go through the contents of the grooves. Okay, these are important for your OSPE exam and also for your Viva exam. And now come to the posterior part of the atrioventricular groove. Posterior part of the atrioventricular groove, it actually it is C-shaped and it basically contains the coronary sinus. Okay, coronary sinus is present in the coronary sulcus. Okay, so coronary sinus and the circumflex branch of the left coronary artery, this is the content of the posterior part of the atrioventricular groove on the left side, and on the right side, the trunk of the right coronary artery. Okay, so there's an important question. What do you mean by crux of the heart? See here. Here, there's a meeting point. Meeting point of what? The interatrial groove, the posterior part of the ventricular groove, I'm sorry. See, the posterior part of the atrioventricular groove and the posterior interventricular groove. Here is the junction, right? Here is the meeting point of three grooves: interatrial groove, posterior part of the atrioventricular groove, and posterior interventricular groove. Here there's a meeting point, and this point is known as the crux of the heart. In the viscera, you have to point the crux of the heart by your index finger. So you should know. Okay, so that is the crux of the heart. And if I want, yes, okay. If I want to tell you about the features, I have told you about the gross anatomical features already, and you should go through the book now. This is an outline only. Okay, vast topic. Heart, pericardium. This is a vast topic, and this is very difficult to cover in one class. Actually, this is only an outline. Okay, so now come to the interior of the heart. These are the external feature and posterior view. This is the base of the heart. Basically, this is formed by the 2/3 by the left atrium and 1/3 by the right atrium. And these are 4 pulmonary veins. And this is the coronary sinus present in the coronary sulcus. Posterior part of the atrioventricular groove, and this is the posterior interventricular groove, and this contains the posterior interventricular artery and the middle cardiac vein. Okay, and this is the trunk of right coronary artery. So yes, this is a very important question. If I want to tell you about the histological structure of heart. Heart is a blood vessel, actually, right? It is the largest vasa vasorum, And what is vasa vasorum? Blood vessel to the blood vessel. Okay. Blood vessels supply some structures, supplies the cells and organs of our body, but they also need their own blood supply. They also need their own nutrition. So the blood vessels that supply the blood vessels that are known as vasa vasorum, and largest vasa vasorum of our body is the heart. Okay, and heart has got the same histological structure like a blood vessel: tunica intima, tunica media, and tunica adventitia. Okay. And fatty deposition occurs actually in the tunica intima. Okay, that is in the subendothelial layer. Fatty deposition occurs. Fatty deposits occur. And if I want to tell you about the cross section of the heart, okay, if I want to tell you about the cross section of the heart, the right ventricle is 3 times thinner than the left ventricle. There's a question, there's a clinical question, or there's an explanatory question in your written exam. Why the wall of the left ventricle is thicker than the right ventricle? You have to answer this. Okay, so most of the, what should be the answer? Because the resistance, okay, the resistance in the pulmonary trunk is less than the resistance in the aorta. Okay, so left ventricle has to pump blood against greater resistance than the right ventricle. Okay, so as it pumps the blood against greater resistance, that's why it becomes more thicker. It's actually the criteria of muscles of our body, that muscles become hypertrophied, muscles become thicker whenever they act more. Okay, after exercise, our muscles become thicker and hypertrophied, and they become prominent, right? So in case of left ventricle, they have to they have to give more force to pump against a greater resistance that is present in the aorta. Okay, So that's why left ventricle is 3 times thicker than the right ventricle. Wall of the left ventricle is 3 times thicker than the right ventricle. And obviously, left ventricle has to pump more blood than the right ventricle because it has to maintain the systemic circulation or greater circulation. It has to supply the whole body the oxygenated blood, right? Okay, so this is another question. And now, if I want to tell you about the interior of the heart, here, interior of the heart, the interior of the right atrium at first, the right atrium has got 2 parts in its interior, okay? A smooth part that is known as sinus venerum and rough part that is known as atrium proper, okay? And these 2 parts are separated by crista terminalis, okay? Crista terminalis. I have uttered this name at the beginning of my class. That crista terminalis is indicated in the outside along the right border that is known as sulcus terminalis. Okay, so crista terminalis divides the 2 parts of the right atrium, interior of the right atrium. The smooth part is known as the sinus venerum and the rough part is known as the atrium proper. And I want to tell about the development of these parts along with the interior. Development of heart is another topic of description, and it actually demands another class. So just I want to tell you the source, developmental source. So the sinus venerum is developed from the absorbed right horn of sinus venerum, venosus. Okay, sinus venerum is developed from the absorbed right horn of sinus venosus. This is the primitive heart tube. Okay, this is the primitive heart tube and it has got 4 parts. This is the bulbus cordis, this is the primitive ventricle, this is the primitive atrium, and this is known as sinus venosus. Okay, it has got 2 horns, right horn and left horn. So absorbed right horn of sinus venosus gives rise to what? Gives rise to this sinus venerum, that is the smooth part of interior of right atrium. And the rough part or atrium proper is developed from the right half of primitive atrium here. Okay, this is the atrium, this is the primitive atrium, and it will be divided into 2 parts, right part and left part. And from the right part, the atrium proper or rough part of the interior of the right atrium will be developed. This is the developmental source. So if I want to tell you about the features of the sinus venerum or smooth part of right atrium, there are several openings. Okay, just see the opening of the superior vena cava, the opening of the inferior vena cava, the opening of the coronary sinus, superior inferior vena cava and coronary sinus. These are the openings present in the smooth part of right atrium. Okay, and the opening of the inferior vena cava and the opening of the coronary sinus, they are just a minute. So they are open. The opening of the inferior vena cava and the opening of the coronary sinus, they are guarded by valves, but the opening of the superior vena cava is not guarded by valves. Why? This is a question. Because blood here is drained along the gravity. Okay, so gravitational force helps to for drainage of blood from the superior vena cava. Here, no valve is needed. But in case of inferior vena cava and in case of coronary sinus, there is no valve there. Okay, so what's the situation? Was the position of opening of superior vena cava? Superior vena cava is located in the upper and posterior part of the sinus venerum, and inferior vena cava is present in the lower and posterior part of the sinus venerum. Okay, and opening of the coronary sinus is located in between the opening of inferior vena cava and right atrioventricular orifice. Okay, here right atrioventricular orifice is present here, and this is the opening of inferior vena cava, and somewhat here the opening of coronary sinus is present, and also the foramina venerum minimarum. There are small veins. Okay, veni cordis minimi. They are named veni cordis minimi for the venous drainage of heart. And they are opened into the smooth part of right atrium through foramina venerum minimarum. So these are the features of interior of right atrium, smooth part. And what are the features of rough part? In the rough part, there is present a presence of crista terminalis. Okay, crista terminalis. This is a smooth muscle ridge which extends from upper part of interatrial septum. This is the interatrial septum actually. The both atria, they are separated by interatrial septum, and the both ventricles are separated by interventricular septum. Okay, both ventricles are separated by interventricular septum. Sorry, this is the interatrial septum. And the interventricular septum has got a muscular part and a membranous part. And if actually during the development at first, there are several openings, and both hearts, right heart and left heart, are communicated with each other. But whenever the pulmonary circulation is established, the baby first cries, then the openings are closed actually. Okay, and there's no gap, no communication between the both hearts. But if due to presence of persistence of any foramen, the both hearts are communicated, that's a congenital anomaly. Okay, so septal defect, we call them septal defect. If the septal defect is present in the atrium, that is known as atrial septal defect. And if that is present in the ventricle, that is known as ventricular septal defect. And these septal defects can be corrected. Okay, so what is in this relation, I want to tell you about the I will tell you about the sources of development. Okay, and there are some developmental or congenital anomalies related to heart. You should go through this in the development or embryology part. And very important question is tetralogy of Fallot. Okay, Fallot's tetralogy. What are the components of Fallot's tetralogy? There are 4 components. And what do you mean by ventricular septal defect? In which part of the ventricular septal defect occurs? Okay. So I was in the interatrial septum, right? The interior of the right atrium, the rough part, their crista terminalis is present, and also musculi pectinati is present. Musculi pectinati are muscular ridges. Okay, here I can see, if you go through the Ekedatto thorax part, there a very good picture is there. And you can see the musculi pectinati and crista terminalis. Musculi pectinati are ridges, muscular ridges, and they are the site for thrombus formation. Okay, and now come to the interatrial septum. Interatrial septum presents fossa ovalis, limbus fossa ovalis. Fossa ovalis, what's this? Fossa ovalis, it actually represents or the remnant of foramen ovale. Okay, foramen ovale, what's that? I haven't enough time to explain that now. That's will be explained in the development of heart. Okay, so fossa ovalis is the remnant of foramen ovale, and its floor represents septum primum, and its sickle-shaped sharp margin represents the septum secundum and known as limbus fossa ovalis. These all are the features of interior of right atrium. Okay, and there is also triangle of Koch. This is a triangle that contains AV node. Okay, triangle of Koch. You should know the boundary of the triangle. What are the 3 boundaries of triangle of Koch? Okay, and torus aorticus. Torus aorticus is an elevation that is made by at the anterior superior part of the interatrial septum, and that is the bulging of right posterior aortic sinus. Okay, ascending aorta has got 3 dilatations that are known as aortic sinus. Ascending aorta, if you can remember, ascending aorta is the outflow tract of the left ventricle, and it has got 3 dilatations: anterior aortic sinus, right posterior aortic sinus, and left posterior aortic sinus. Okay, right posterior aortic sinus, if it is bulged in the interatrial septum, and that bulging is known as torus aorticus. That is a feature of atrium proper of interior of right atrium. Okay, so I have already told you about the developmental source. Now come to the right ventricle. In the right ventricle, there is a tricuspid valve complex. Okay, tricuspid valve complex. And at first, the right ventricle, interior of the right ventricle, it also can be divided into 2 parts: inflowing, rough part. Inflowing, that means inflow, the pathway for blood entrance, that is the inflowing part. Okay, that is rough part, remember that, and that is known as ventricle proper. Okay, and the outflowing smooth part, outflowing part is the smooth part. Okay, and outflowing a smooth part is known as infundibulum or conus arteriosus. Infundibulum or conus arteriosus, this is the outflowing smooth part. Okay, so if I want to tell you about the developmental source at first, the inflow tract is developed mostly from right part of primitive ventricle, and the outflowing smooth part is the remnant of right part of bulbus cordis. Okay, remnant of right part of bulbus cordis, that is the outflowing part of the developmental source of outflowing part of the right ventricle. Now come to the features of the inflow tract. Right atrioventricular orifice or tricuspid valve complex is present there, and this valve complex is made up of 3 things. Okay, leaflets of or cusps, tricuspid, that means there will be 3 cusps. Okay, tricuspid valve complex, that means there will be 3 cusps, and these cusps are connected to the papillary muscle by threads, by some collagenous threads that are known as chordae tendineae. Okay, so tricuspid valve, chordae tendineae, and papillary muscle together they form the tricuspid valve complex. Okay, why they are called tricuspid valve complex? Because there are 3 papillary muscles and 3 cusps there. Okay, and in case of left side, in case of left ventricle, there are 2 papillary muscles and 2 cusps connected by chordae tendineae. Okay, so as a whole, these 3 structures are called valve complex. In the right side, tricuspid valve complex. In the left side, bicuspid valve complex. Okay, so if I want to tell you about the tricuspid annulus, here the tricuspid annulus must be present, and this is a collagenous ring after the succeeding the orifice, and here the bases of the cusps are attached. Okay, and tricuspid valve complex, that means the valve complex has got 3 cusps. Okay, these 3 cusps are anterior, posterior, and septal cusp. Anterior, posterior, and septal cusp. These are their names. Okay, and the picture you will practice from Eke Dotto. Okay, and you obviously you should go through the NEETer book. Okay, in anatomy, you should go through pictures, diagrams, figures as much as you can. That will clear your conception. Actually, the soft part without the viscera, without showing the viscera, is a bit tough for me and also tough for you. I'm giving you an outline only. Okay, this is an outline only. I'm telling repeatedly. So the anterior, posterior, and septal cusps are there, and the anterior cusp is the junction of the cusps are represented by commissures. Okay, the junctions are known as the commissures, and the cusps are attached. The cusps or leaflets are attached to the papillary muscle by chorditendinae, and there are three zones actually. Okay, rough, clear, and basal zone. The basal zone is present alongside the tricuspid annulus or base. Okay, and clear zone, this is devoid of chorditendinae, and this is thin, and the rough zone is containing the attachment of the chordae. Okay, so chorditendinae, what is it? It is these are endothelial covers, cartilaginous threads. Okay, collagenous, I'm sorry, these are endothelial covered collagenous threads. Okay, made up of collagen fibers and covered by endothelium. And they are of two types, true chordae and false chordae. Actually, chorditendinae that are present in the valve complex, they are true chordae. Okay, that are connected with the papillary muscle in one side and with the cusp in another side. Okay, there are some chordae that are not connected to the papillary muscle or the cusp. They are connected only to the ventricular walls that are known as false chordae. Okay, and papillary muscle, these are the muscles that are conical muscular projections, and they are responsible for proper contraction or maintenance of contraction of the valves, atrioventricular valves. Okay, tricuspid valve in the right side and bicuspid valve in the left side. Whenever they contract, they help in proper closure of the valve whenever it's needed. Okay, so these are conical muscular projections, present 3 in number on the right side and 2 in number on the left side. Okay, and there is trabeculicarny. Trabeculicarny, what does it mean? Is composed of ridges, bridges, and papillary muscle. This can you can face this in the written exam. Short note, trabeculicarny. Okay, what is this? This is made up of ridges, bridges, and papillary muscles. Okay, so ridges, they are linear elevations in the ventricular wall. You can see in the picture. See, these are the ridges, and bridges, they are attached to the ventricular wall only by their 2 ends, but at the middle they are free. Okay, just like bridge. Okay, so bridges will be like this. At one end it will be attached and another end it will be attached, but in between them there will be a passage. Okay, and septomarginal trabecula, it's an important specialized bridge. Okay, and it connects the ventricular septum. It connects the ventricular septum with the anterior papillary muscle. It connects the ventricular septomarginal trabecula. It connects the ventricular septum with the anterior papillary muscle. This is important because it will be needed in the conducting system of heart. Okay, so trabeculicarny is made up of ridges, bridges, and papillary muscles. I have already told you about this. Features of outflow tract. These are all the features of the inflow tract or rough part. Okay, or ventricle proper, tricuspid valve complex, and in the tricuspid valve complex, tricuspid annulus, leaflets, and then chorditendinae, papillary muscles. In the papillary muscle, under the heading of papillary muscle, I told you about the trabeculicarny. Okay, now come to the smooth part or infundibulum. That is known as infundibulum also. So smooth part that is directed upwards, backwards, and to the left, making an obtuse angle with the inflow tract. Okay, and this is conical and smooth whorl, and we all know that actually the outflow tract is guarded by a semilunar valve. Okay, pulmonary semilunar valve. There's the semilunar valve present there. Okay. And about the left atrium, if I want to tell you about the left atrium, how it's formed, it's situated behind the left side of the right atrium and forms 2/3 of the base of the heart. And what it contains an auricle in its gross feature, and that's an important site for development of thrombus. And its development, posterior part is developed from endocardial cushion of single pulmonary vein, and anterior part including left auricle is developed from the left half of primitive atrium. Okay, so anterior part is developed from the left half of primitive atrium. Anterior part of left atrium is developed from the left half of primitive atrium, and posterior part is developed from endocardial cushion. Okay, at first there is a single pulmonary vein and they will be divided into 4 pulmonary veins later on. And about the interior of the left ventricle, there is also a inflowing part and outflowing part, and there is bicuspid valve complex, and there will be presence of 2 papillary muscles and 2 cusps, and just like the interior of the right ventricle, there will be trabecular kerning. Okay, but what's the difference? The wall is 3 times thicker than the right ventricle. I have already told you. And if I tell you about the cross section of the ventricles, you can have viscera of cross section of ventricle. How can you identify right and left ventricle in the cross section of the viscera? How can you identify? Number 1 point is the thickness of the wall. The wall of the left ventricle will be 3 times more thicker than the wall of the right ventricle. And number 2 is the shape of the cavity. Okay, the shape of the cavity of the left ventricle is circular. Okay, in case of right ventricle, that is semilunar. Why? Due to the interventricular septum. The interventricular septum, actually, this is deviated somewhat to the right side. Okay, it is deviated somewhat to the right side. It's deviated somewhat to the right side. So that's why the cavity of the right ventricle will be semilunar in cross section, and the cavity of the left ventricle will be circular in cross section. Okay, so this is all about the interior of the heart in short. And interatrial septum, I have already told you about the features. Fossa ovalis, limbus fossa ovalis, foramina venarum minimarum, and AV node. AV node is present in the triangle of Koch, and fossa ovalis is the remnant of foramen ovale. Its floor is represented by septum primum, and is sharp margin, that is sickle-shaped margin, that is named limbus fossa ovalis, that represents actually the septum secundum. Okay, and developmental anomaly, atrial septal defect. And ventricular septum has right and convexity towards the right ventricle. Interventricular septum has a convexity towards the right ventricle. It consists of 2 parts, muscular and membranous part, right? So the muscular part occupies the anterior-inferior part of the septum, and the membranous part occupies the posterior-superior part of the septum. Okay, membranous part occupies the posterior-superior part of the septum, and congenital anomaly is known as VSD. Okay, congenital anomaly is known as the VSD. I've already told you about the structure of the heart. Now come to the fibrous skeleton of the heart. Our body, we need a skeleton, right? For proper framework, for proper shaping of the body. And heart, being a muscular organ, it also needs a framework. It also needs a shape that is maintained by fibrous skeleton of heart. It is made up of 4 fibrous rings present at the bases of both ventricles. And these 4 fibrous rings are present around tricuspid valve, bicuspid valve, and the semilunar valves present in the pulmonary trunk and ascending aorta. Okay, so around right and left atrioventricular orifices and around pulmonary and aortic orifices, there are 4 fibrous rings that together form the skeleton of heart. Okay, and they give attachment of the cusp, membranous part of interventricular septum, and continuation of atrial and ventricular musculature. They are responsible for the continuation of atrial and ventricular musculature. What are their functions? If I want to tell you, they maintain the shape of the heart, This is number 1 point, and they give attachment to the cusps of the tricuspid and bicuspid valvular complex and the membranous part of the interventricular septum. Okay, so membranous part is the inferior part of the septum. Okay, and disturbs the continuation between atrial and ventricular muscles and insertion of heart muscles. All the heart muscles, all the cardiac muscles present in the myocardium of heart, they are inserted into the fibrous rings. Okay, so their main function is to maintain the shape of the heart. Okay, and conducting system of heart. If I want to tell you about the conducting system of heart, actually conduction of nerve impulses is not neurogenic. It's musculogenic or myogenic. Okay, in case of heart, the conduction of the system is myogenic, and the conducting system of heart has got several parts. What are they? Sinoatrial node or SA node, AV node, AV bundle or bundle of His, and right and left bundle branches, and Purkinje fibers. Okay, these are the component parts of the conducting system. And if we want to define the conducting system of heart, they are made up of specialized cardiac myocytes that are responsible for initiation and conduction of cardiac impulses. Okay, so cardiac impulses are myogenic, not neurogenic. This is important. And they are initiated and conducted by conducting system of heart. What are the component parts of conducting system? SA node, AV node, AV bundle or bundle of His, right and left bundle branch, and Purkinje fibers. These are the component parts of conducting system. This is an important question of written exam. You have to draw it. Okay, draw the conducting system of heart. And interior of right atrium and right ventricle is also important. You have to draw the interior of right atrium and right ventricle for the written exam. Okay, so I have told you about the specialized cardiac myocyte. What are the specializations of these cardiac myocytes? These cardiac myocytes are very much thinner than the normal cardiac myocytes, usual cardiac myocytes. They are thinner, and they are not responsible for contraction. They have no contractile power, but they have the power of generating cardiac impulse. Okay, these are the 3 differentiating points of conducting system of heart, parts of conducting system of heart other than normal cardiac myocytes. Okay, they are specialized cardiac myocytes. Okay. If I want to tell you about the SA node is for the pacemaker of heart. This is an important explanatory question. Why SA node is called the pacemaker of heart? Because it initiates the cardiac impulse. It produces all the components of conducting system of heart have the capability to initiate cardiac impulse. Okay, but SA node is called the pacemaker. Why? Because it's first. It initiates the cardiac impulse at first, earlier than other parts of the conducting system, and it generates cardiac impulse at a higher rate than other parts of the conducting system. The rate is 70 to 80 per minute. Okay, what is our normal heartbeat? That is also 70 to 80. Actually, 60 to 100 is the normal range. Okay. 72 is average. So 70 to 80 beats per minute. This is the rate of generation of cardiac impulse by the SA node. And SA node is present. What is the situation of SA node? SA node is present actually. Where it is present? It is present actually right side of superior vena cava to the upper part of crista terminalis. Okay, right side of superior vena cava and to the upper part of crista terminalis. There it's situated. Okay, and SA node is connected to the AV node that is present in the triangle of Koch. I have already told you, right? Triangle of Koch was the presenting feature in the interatrial septum of the rough part of interior of right atrium, right? So triangle of Koch lodges the atrioventricular node or AV node, and AV node is the second in the second position to generate cardiac impulse, and SA node and AV node are connected by several internodal pathways. Okay, and the bundle of His that is present actually at the junction of muscular and membranous portion of the interventricular septum, and that bundle of His is actually the whole cardiac muscle, atrial musculature and ventricular musculature, they are not connected to each other. Okay, they are separated from each other, but here at the bundle of His, they are connected. Okay, so bundle of His is present at the junction of membranous and muscular portion of the interventricular septum, and from the bundle of His, there is right bundle branch and there is left bundle branch. The left bundle branch enters into the subendothelial layer and divides into several branches of Purkinje fiber. And right bundle branch is what should I say? It goes to the right side, right ventricle through the I have uttered a name, if you can remember, in case of trabeculic carne, I have uttered a name. That name was septomarginal trabecula. Okay, so through this septomarginal trabecula, the right bundle branch of conducting system enters into the, or it is communicated to the anterior papillary muscle of the wall of the right ventricle. Okay, and then it is divided into several branches. It goes into the subendothelial layer and divides into Purkinje fibers, and they are connected, and thus the cardiac impulse is conducted through the conducting system of heart. Okay, and if I want to tell you about the nerve supply of heart, this is a small topic, that's why I'm telling this at first. Nerve supply, heart is supplied by cardiac plexuses. Straightforward, I'm telling you, heart is supplied by cardiac plexuses. There are superficial cardiac plexus and there are deep cardiac plexuses. Okay, so superficial cardiac plexus situation is important. Situation, superficial cardiac plexus is situated below the arch of aorta and in front of right pulmonary artery, and deep cardiac plexus is situated behind the arch of aorta and in front of bifurcation of trachea. Okay, this is the situation of both cardiac plexus, and heart is supplied by, actually heart is an autonomous organ, right? It is supplied by autonomic nervous system, and we all know that autonomic nervous system has got a sympathetic component and a parasympathetic component, right? So heart is supplied by autonomic nervous system via cardiac plexus. Sympathetic and parasympathetic nerve supplies are there, and sympathetic supply of heart comes from upper 4 or 5 segments of thoracic segment of spinal cord. Okay, upper 4 or 5 thoracic segment of spinal cord, and parasympathetic nerve supply comes from both vagus. Okay, so sympathetic is cardiostimulatory. You have to remember that sympathetic is cardiostimulatory and parasympathetic is cardio-inhibitory. And what are the effects of sympathetic nervous system on heart? If we want to describe, we should remember some points. Sympathetic nervous system increases the heart rate, increases the force of contraction, and increases the cardiac output. Okay, and alpha receptors that are present in the epicardium. In the epicardium, the alpha receptors are present, and sympathetic nervous system causes vasoconstriction in the epicardial vessels. And beta receptors are present in the myocardium, and sympathetic nervous system causes vasodilatation of the myocardial vessels. And so as a whole, cardiac output is increased by stimulation of sympathetic nervous system. And pain sensation of the heart also carried by afferent fibers from sympathetic nervous system. And parasympathetic nervous system is cardio inhibitory, so it decreases all the things, heart rate, force of contraction, cardiac output, and blood pressure. They are decreased by parasympathetic nervous system. Blood pressure is increased by stimulation of sympathetic nervous system. Okay. Sympathetic nervous system is the emergency nervous system of our body. Whenever we are shocked, whenever we are afraid, then sympathetic nervous system is stimulated. And just think of that situation: your heart rate is increased, your force of contraction of heart, your cardiac output, and blood pressure is also increased by stimulation of sympathetic nervous system. And parasympathetic nervous system causes just opposite effects. And parasympathetic nervous system increase nodal delay. Okay, increase nodal delay. That means if parasympathetic nervous system is stimulated, there will be increased nodal delay. Now come to the very, very important point: blood supply of heart. Blood supply, we all know that blood supply of heart constitutes arterial supply and venous drainage, right? Okay. So arterial supply is and it's very important. So I should start with the venous drainage. Okay, venous drainage of heart is I will tell you in short. Okay, and I can show you the venous drainage. You can see here the blood supply of heart actually, and venous drainage and arterial supply both are important written questions. Okay, you will face obviously you will face OSPI, MCQ, and in Viva you will be asked invariably, but you have to practice the diagrams or pictures. Okay, so if I want to tell you about the venous drainage of heart, most of the blood from the heart, they are drained by coronary sinus. Okay, coronary sinus drains 60% of venous blood from the heart. Okay, and coronary sinus drains 60% venous blood, and it takes blood. It takes blood from the I think it takes most of the blood from the left coronary artery, because left coronary artery is wider and it provides a huge volume of blood supply, most of the volume of blood supply to the heart. So most of the blood drained from the left coronary artery are drained by coronary sinus, 60%, that is 60%. And the remaining 40% of the blood from the heart, they are drained by anterior cardiac veins and veni cordis minimi. Okay, anterior cardiac vein, I have uttered this name whenever I told you about the contents of right part of anterior interventricular groove, if you can remember. The right part of anterior interventricular groove contains the trunk of right coronary artery, actually the first segment, and it's crossed by anterior cardiac veins. Okay, so anterior cardiac veins, they are 3 or 4 in number. They drain blood from the infundibulum or outflowing part or smooth part of the right ventricle and end directly into right atrium through foramina venerum minimorum. Through foramina venerum minimorum. Just a minute. Okay, so anterior cardiac veins are 3 or 4 in numbers. They are present in the right part of atrioventricular groove, anterior atrioventricular groove, and they drain blood from the infundibulum of the right ventricle, and ultimately they terminate directly into the right atrium through foramina venerum minimorum. And foramina venerum minimorum was the these were the presenting feature of the interior of smooth part of right atrium, if you can remember, right? So you should correlate. You should try to correlate. Okay. So anterior cardiac veins, they drain blood from the infundibulum of the right ventricle. Okay, and also they drain blood from the right coronary artery. And I have told you about the veni cordis minimi. Veni cordis minimi, these are veins opens into different chambers of the heart through the foramina minima, and they are more numerous in the atrial septum. Okay, so anterocardiac vein and foramina venerum minimarum, veni cordis minimi, they together drain 40% of the venous blood from the heart. Now come to the coronary sinus. This can be a short note for your written exam. What is coronary sinus? This is a wide venous channel. Okay, this is a wide venous channel. Its location, where it's located in the coronary sulcus. Okay, so where the coronary sulcus is a C-shaped sulcus. It's present basically on the posterior part, left posterior part of the atrioventricular groove. Okay, left posterior part, posterior atrioventricular groove, left part of the posterior atrioventricular groove. There is a C-shaped coronary sulcus, and that is the location of coronary sinus. Coronary sulcus contains coronary sinus, not only the coronary sinus. Okay, the contents of coronary sulcus are coronary sinus, proximal part of right coronary artery, and circumflex branch of left coronary artery. Okay, this is the content of coronary sulcus. And I was talking about the coronary sinus. This is a wide venous channel, and this drains most of the blood, 60% of the blood from the heart. And it starts, or commencement of the coronary sinus is present where? Commencement of the coronary sinus is present in the left part of atrioventricular groove. Okay, where it receives the termination of great cardiac vein. Okay, from there it starts, and ultimately it ends directly into the right atrium, in the smooth part, interior of the smooth part of the right atrium. I have told you about the opening of the coronary sinus. That's where it is situated. Okay, so coronary sinus ultimately drains directly into the right atrium, and it has some tributaries. Okay, arteries have branches, and veins have tributaries. So veins, coronary sinus has got several tributaries. What are they? They are a great cardiac vein, middle cardiac vein, small cardiac vein, oblique vein of left atrium, and then posterior vein of left ventricle. And there are some other veins, left marginal vein and right marginal vein. I have uttered this name whenever I told you about the inferior border and left border of heart, right? So if I want to tell a bit in short about the tributaries of coronary sinus, great cardiac vein, it actually starts from the apex of the heart. Okay, it starts from the apex of the heart. Here, this is the great cardiac vein. It starts from the apex of the heart. It is accompanied it is present, or it is lodged in the anterior interventricular groove along with the anterior interventricular branch of the right coronary artery, and ultimately it is terminated into the coronary sinus at the left part of anterior atrioventricular groove, right? And sometimes left marginal vein is drained into the great cardiac vein close to its termination. Okay, sometimes it receives termination of left marginal vein. And middle cardiac vein, it passes from the apex along the posterior interventricular groove. From the apex along the posterior interventricular groove, middle cardiac vein passes, and it is lodged in the posterior interventricular groove along with the posterior interventricular branch of right coronary artery, and ultimately it terminates close to the right end of coronary sinus. Okay, and small cardiac vein, it is situated in the atrioventricular groove between the right atrium and right ventricle, and opens at the right end of sinus. Usually it receives right marginal vein. Okay, right marginal vein, I have told this name along with the right marginal artery. Right marginal vein and right marginal artery are accompanied at the inferior border of the heart. We can identify the inferior border of the heart by presence of them. And this right marginal vein, sometimes it is drained into the small cardiac vein, and sometimes instead of joining the small cardiac vein, this right marginal vein opens directly into the right atrium. Okay, oblique vein of the left atrium, it drains the posterior surface of the left atrium, and it's a small vein, and it joins with the coronary sinus close to the left end of it. Okay, close to the left end, it is joined with the coronary sinus, oblique vein of left atrium. And the posterior vein of the left ventricle. Posterior vein of the left ventricle, it drains the inferior surface or diaphragmatic surface of the left ventricle, and it ends in the sinus on the left side of the middle cardiac vein. Okay, so this is all about the venous drainage of the heart. And now come to the arterial supply of the heart. This is very important, and you have to be very attentive whenever I'm talking about the arterial supply of the heart. Okay, so heart is supplied by right and left coronary arteries. Right and left coronary arteries. Sometimes third coronary artery may be present, but that's an exception. I will tell you that later on. Usually heart is supplied by two coronary arteries, right and left coronary arteries. There's an explanatory question comes into your written exam. Why the coronary arteries are called functional end arteries? Coronary arteries are the vasa viscerum. Okay, they are the vasa viscerum of heart, and they are the largest vasa viscerum. Why they are called functional end arteries? That's why we have to know what is end artery, right? End arteries are the arteries that don't have any precapillary anastomosis. Okay, there will be no precapillary anastomosis in case of end artery. There is only one true end artery in our body, that is the central artery of retina. That is the true end artery of our body. The central artery of retina has got no precapillary anastomosis. And coronary artery is functional end artery. Why it's called functional? Because it has got precapillary anastomosis, but that anastomosis are not sufficient for maintenance of circulation whenever the main arterial trunk is blocked. Okay, so they are called functional end arteries. And what are the sites of precapillary anastomosis? Where the artery is anastomosed, where the coronary artery is anastomosed. One of the sites is at the crux of the heart. Another site is at the posterior interventricular groove, right? And there are several other sites you can go through. Okay, so what are the sites of anastomosis? You can go through. There are interarterial anastomosis, there are arteriovenous anastomosis, there are arteriocapillary anastomosis. You can go through it. And now come to the arterial supply of heart. Heart is supplied by both coronary arteries, I have already told you. And the right coronary artery, it arises from the anterior aortic sinus. Previously, I have told you that ascending aorta has got three dilatations that are known as aortic sinus, right? One is the anterior aortic sinus, one is the right posterior aortic sinus, one is the left posterior aortic sinus, right? So from the anterior aortic sinus, the right coronary artery is produced, is started. Okay, so the site of arousal of right coronary artery is the anterior aortic sinus, and after origin, the right coronary artery, the trunk of right coronary artery, it usually passes forwards and to the right between the pulmonary trunk and the right auricle. See, from the after origin from the anterior aortic sinus, it passes forwards and to the right, In between here, there is the pulmonary trunk. In between the pulmonary trunk and the right auricle. Okay. And then it passes downwards and to the right along the right part of atrioventricular groove, anterior atrioventricular groove. Okay. Then passes downwards and to the right along the right part of anterior atrioventricular groove and up to the inferior border of the heart. This portion of the right coronary artery is known as the first segment. Okay. And after this, the trunk of the right coronary artery winds round the inferior border of the heart and it lodges the posterior atrioventricular, posterior part of the atrioventricular groove. This is also the trunk of right coronary artery. Okay. See, you can follow my cursor. This is also the trunk of right coronary artery. And this is known as the second segment of the right coronary artery. Okay. And it ends by anastomosing with the circumflex branch of the left coronary artery at the crux of the heart. And before ending, it gives off posterior interventricular branch in most of the cases. I have used the word most of the cases. Why? There is a reason I will explain. Okay, so in most of the cases, it gives off posterior interventricular branch that is lost in the posterior interventricular groove. Okay, so this is the course of right coronary artery. And what are the branches of right coronary artery? Branch of first segment, if I want to tell you, the right conus artery. Right conus artery is the first branch of right coronary artery. It supplies the infundibulum of the right ventricle. Infundibulum, what was that? If you can remember, infundibulum is the outflowing part or smooth part of the right ventricle. It is supplied by the right conus artery. Okay. And it anastomoses with the left conus artery, that is the branch of left coronary artery. So here there is a site of anastomosis of both coronary arteries. Okay. So right conus artery, this is the branch of first segment of right coronary artery. Sometimes, instead of arising from the trunk of right coronary artery, right conus artery can arise directly from the anterior aortic sinus. Okay, so if it arises directly from the anterior aortic sinus, then this right conus artery, then its name will be third coronary artery. Okay, and now come to the next branch, anterior ventricular rami. Anterior ventricular rami. See, these are 3 or 4 ventricular rami. 3 or 4 ventricular rami of first segment of right coronary artery. They supply several parts of the ventricle, and the largest branch is known as the right marginal artery. Okay, so right marginal artery is one of the anterior ventricular rami of the right coronary artery. It follows the inferior border of the heart and supplies the adjoining areas of sternocostal and diaphragmatic surfaces. Okay, so anterior ventricular rami, they are 3 to 4 in number, supply sternocostal surface of the right ventricle and arise at right angle from the trunk of right coronary artery. The largest anterior ventricular rami is known as right marginal artery that follow the inferior border of the heart and supplies the adjoining surfaces of the ventricular surface of the sternocostal and diaphragmatic surface. Okay, and atrial rami. There are several atrial rami from here in the upward direction. See, there are some atrial rami arising from the first segment of the right coronary artery, and they are present in several groups. Anterior and lateral group, they supply the myocardium of heart, and the SA nodal artery. SA nodal artery is one of the atrial rami. Okay, so SA node that is present in the right atrium, and SA nodal artery in 65% cases, SA nodal artery is derived from the first segment of the right coronary artery. Okay, and what about the rest of the 35% cases? It arises from the left coronary artery. Okay, so SA nodal artery in 65% subjects, not cases, in 65% persons or subjects, SA nodal artery is derived from the first segment of right coronary artery, and this is one of the atrial rami. Okay, now come to the branches of the second segment of the right coronary artery. Posterior ventricular rami, they supply the adjoining surfaces of the ventricles, diaphragmatic surface actually of the ventricles, and posterior interventricular artery. Posterior interventricular artery, it supplies actually the posterior inferior 1/3 of interventricular septum. Posterior inferior 1/3 of interventricular septum, that is supplied by posterior interventricular artery, and there are some posterior atrial rami. Okay, okay, thank you. And if I want to gist the total supply of the right coronary artery supplies whole of the right atrium, okay, most of the right ventricle, except a strip along the anterior interventricular groove, okay, except a strip along the anterior interventricular groove. So whole of the right atrium is supplied by the right coronary artery, whole of the right ventricle, most of the parts of the right ventricle is supplied by right coronary artery, except a strip along the anterior interventricular groove, okay, and a strip along the posterior interventricular groove is supplied by the right coronary artery. Okay, only a strip along the posterior interventricular groove is supplied by the right coronary artery, and the posterior inferior 1/3 of interventricular septum is supplied by right coronary artery. Most of the part of the conducting system is supplied by the right coronary artery, except a little portion of left bundle branch, and I have told you a condition that in case of 65% person, the SA nodal artery arises from the right coronary artery. Okay, so right atrium whole, right ventricle most parts except a strip along the anterior interventricular groove. Only a strip along the posterior interventricular groove is supplied by the right coronary artery. Posterior inferior 1/3 of the ventricular septum is supplied by right coronary artery, and most of the parts of the conducting system of the heart except little portion of left bundle branch is supplied by the right coronary artery, and 65%, in case of 65% persons, the SA nodal artery is derived from the right coronary artery. Now come to the left coronary artery. Okay, so left coronary artery, it arises from the left posterior aortic sinus. Okay, it arises from the left posterior aortic sinus, and it's wider and its supplying area is more. Okay, if we compare between two coronary arteries, left coronary artery is wider and it supplies most of the areas, very much areas of the heart, okay, than the right coronary arteries. So after its formation, it is divided into two branches. Okay, here the left coronary artery, just after its formation from the left posterior aortic sinus, it passes in between the pulmonary trunk and left auricle, and there it is divided into anterior interventricular artery and circumflex artery. Okay, this is the circumflex artery. So just after its formation, it's divided into two branches, and anterior interventricular artery, this is the content of anterior interventricular groove. The circumflex artery, that is the content of the left part of the anterior atrioventricular groove, right? So this circumflex artery, then it winds around the left border of heart, and it reaches the crux of the heart, ends by anastomosing with the trunk of the right coronary artery, and it is lost in the posterior part of the left part of the posterior atrioventricular groove, right? So anterior interventricular branch, it gives off left anterior ventricular rami. Okay, left anterior ventricular rami, and this supplies the sternocostal surface of the left ventricle. Left anterior ventricular rami supplies the sternocostal surface of the left ventricle, and one large artery that is known as diagonal artery that is derived from the left anterior ventricular rami. That is one left anterior ventricular rami, large, that is known as diagonal artery, and that supplies the left surface of heart. Okay, and right anterior ventricular rami, one of the branches, right conus artery. Okay, and there are also septal rami. This septal rami supplies anterior superior 2/3 of interventricular septum. This septal rami supplies anterior superior 2/3 of interventricular septum. So anterior interventricular branch, it has got left anterior ventricular rami, right anterior ventricular rami, and septal rami. Okay, so left anterior ventricular rami, one of the large left anterior ventricular rami is known as diagonal artery, and it supplies the left surface of heart. And one branch of the right anterior ventricular rami is right conus artery, and septal rami supplies the anterior superior 2/3 of the interventricular septum. Okay, and circumflex branch provides left marginal artery. It supplies the left surface, left marginal artery, and left marginal artery is present along the left border of heart. I have already told you. And a posterior ventricular rami, it supplies the diaphragmatic surface of left ventricle. Posterior ventricular rami. Okay, these are the posterior ventricular rami. They actually supply the diaphragmatic surface of left ventricle. And atrial rami, posterior surface of both right and left atrium, they are supplied by atrial rami. Okay, so as a whole, the left atrium, the left ventricle, whole of the left ventricle except a strip along the posterior interventricular groove, right ventricle along a strip, along the anterior interventricular groove. So left coronary artery supplies whole of the left atrium, most of the left ventricle except a strip along the posterior interventricular groove, and it also supplies a strip along the anterior interventricular groove, and anterior superior 2/3 of the ventricular septum is also supplied by left coronary artery. Okay, this is the arterial supply. And now two important things are there. By this, we will end today's class. There are some peculiarities of coronary artery. What are the peculiarities of coronary artery? We all know that during ventricular systole, the whole body gets the oxygenated blood and gets the nutrition, but coronary filling occurs during diastole. Okay, filling of coronary artery occurs during diastole. This is an exception and this is a peculiarity. Okay, and there is no significant role of parasympathetic supply on coronary artery. Okay, so there is no significant role of parasympathetic supply of coronary artery. This is another peculiarity. And if I want to tell you that left coronary artery, it sometimes arises from the anterior aortic sinus. Okay, if it arises from the anterior aortic sinus, it has got a longer course, right? It usually arises from the left posterior aortic sinus, but if it arises from the anterior aortic sinus, there will be a longer course, and the course will be in between the aorta and the pulmonary trunk. And whenever this person in whom the left coronary artery arises from the anterior aortic sinus, whenever he exercises vigorously, then there is a chance of compression of this left coronary artery. due to dilatation of the ascending aorta and pulmonary trunk. And whenever this left coronary artery is compressed, there is a chance of sudden cardiac death. Okay. And this left coronary artery can also arise from pulmonary trunk also. And if it is derived from the pulmonary trunk, then cyanotic symptoms and left ventricular failure will be occurred, because pulmonary trunk contains deoxygenated blood. We all know that, right? So there will be symptoms of cyanosis. These are the three peculiarities of coronary arteries. Number one is coronary filling occurs during diastole. Number two is there is less role or no role of parasympathetic supply on coronary arteries. And left coronary artery, instead of arising from the left posterior aortic sinus, they can arise from the anterior aortic sinus and also from the pulmonary trunk. Okay, and very, very important point, our last topic of today's class is the cardiac dominance. What do you mean by cardiac predominance or cardiac dominance? It is actually represented by the origin of posterior interventricular artery. Okay, I use the word most whenever I talk about the branches of trunk of right coronary artery, that in most of the cases, posterior interventricular artery is the branch of right coronary artery. In 80% of cases, actually, okay, in 80% of cases, the posterior interventricular artery arises from the right coronary artery, and in that cases, that persons are thought to have the right coronary or cardiac predominance. Okay, and in 10% cases, they can the posterior interventricular artery can arise from the left coronary artery in 10% cases only, and in that person they are in a greater risk of development of coronary artery disease. Okay, and in the remaining 10% of cases, the posterior interventricular artery can arise both from right and left coronary arteries, and this type is known as balanced type cardiac dominance. Okay, so number one is right coronary dominance or predominance. The posterior interventricular artery, if it arises from the right coronary artery, that is known as right coronary predominance, and it occurs in 80% of subjects or persons. In 10% of subjects, the posterior interventricular artery may arise from left coronary artery, and these persons have a greater risk of having coronary artery disease, and remaining 10% of cases or persons have balanced coronary predominance. In them, the posterior interventricular artery arises both from right and left coronary arteries. Okay, that's all about the coronary or cardiac predominance, and that's all from my part about the heart, about the gross anatomical features and gross anatomical features of heart. Actually, I have touched a bit about the histological part, but the embryological part is remained. Okay, you have to go through the development of heart very clearly. That's systemic embryology actually. So that actually demands another class. Okay, thank you very much. That's all for today.